Hello everyone, welcome to our YouTube channel, Listening Insight with Kadek Mlonga. So today we're going to look at antiretroviral therapy. So here in antiretroviral therapy, we're going to look at the goals of therapy and the initiation of therapy. So we're going to talk about all these things as we go ahead in our lesson. So first and foremost, you should check out the video for the life cycle in order to understand our topic better. So in introduction, we're saying combined ART uses at least 3 drugs from at least 2 classes to decrease the amount of HIV in the body as much as possible. So here we're saying the ART, this combined ART is a therapy that uses at least 3 drugs from 2 different classes. So watch out for the next video that will be posted, and it will explain the classes of drugs, the groups of drugs for HIV. So this is used, the multiple drug helps to prevent emergency or resistance. It also helps to decrease HIV-related deaths, opportunistic infections, and hospitalization. It also helps to sustain viral suppression, but it does not cure HIV infection. So we are saying combined ART uses 2 drugs from it uses 3 drugs from at least 2 different classes, and it helps to decrease the amount of viruses in the body. It decreases the viral load, and it helps in reducing the HIV-related deaths, opportunistic infections, and hospitalization. It also helps to decrease resistance, drug resistance, and also sustain viral suppression. So now we're going to look at the goals of therapy. So the first goal is to decrease the amount of viruses in the body to undetectable levels and to prevent drug resistance. So when the viral load has been reduced to an undetectable level, it means the patient has achieved viral suppression. And when the patient achieves viral suppression, it means the body has less viruses, and it also means that that will prevent drug resistance in their body, because they are taking these viruses, and the viruses cannot build tolerance or resistance against this particular drug therapy. So the first goal, we've said, it is to decrease the amount of viruses in the body, or you can say to reduce the viral load. Then the second one is to restoration and preservation of immune function. Restoration and preservation of immune function. So in restoration and preservation of immune function, we're saying this, when the HIV goes into the body, enters the body, it attacks the CD4 cells. So check out the video for HIV life cycle to understand more. So they attack the CD4 cells and causing destruction to these CD4 cells, meaning there will be reduced CD4 count in the body. So we want to restore and preserve the immune function. So the CD4 cell count should increase approximately 100 cells per millimeter per year, per millimeter cubed per year, or per cubic millimeter per year. So we want to increase the CD4 count by 100 cells per cubic millimeter. And then when the immune function improves, the development of new optimistic infections is unlikely, and the prophylactic or prevention optimistic infection therapy can be stopped. So here we're saying as the immune system improves of the patient, as the CD4 count increases, simply means there will be reduced new optimistic infections coming into the patient or affecting the patient. So optimistic infections are simply infections that come about due to immunocompromised, due to the immune being compromised. And then if optimistic infections are already present, their course may be shortened or made less severe with combined ART. So we're simply saying as the immune system improves, this will develop the immune function, and it will enable the immune function to fight against this optimistic infection. And if the optimistic infection is already present, it means that this good improved immune system will fight off the optimistic infection and shorten the severity or the course of the infections. So that's the second goal, which is restoration and preservation of immunological function. Goal number three is reduction of HIV-related illnesses and deaths. Reduction of HIV illnesses and deaths. So as the immune function improves and virus suppression in the patient improves, when the virus suppression is achieved, it will stop the progression of HIV disease into the latter stage, which is the AIDS and later on death. So as the immune system improves and the patient achieves virus suppression, the replication of the viruses will stop and prevent the HIV disease going into the latter stage, which is AIDS. And with this will improve the health of the patient and prevent HIV-related illnesses and deaths. Development of new optimistic infection is unlikely, and patients are less likely to require hospitalization or to die from AIDS. So this combined ART will help in improving the immune system and causing virus suppression, causing the patient to achieve virus suppression. Therefore, there will be reduced optimistic infection that will occur, and this will also lessen patients being hospitalized or die from AIDS. So combined ART has shown to benefit both children and adults. So it helps and benefits the health of both adults and children. The fourth goal is improve the quality of life. Improve the quality of life. So HIV is known to be a virus, a disease that will cause the person to lose weight, to be fatigued, so that the patient can be less productive and all that, because it affects the immunity of the person. So this combined ART will improve the immune function and cause viral suppression, which will stop the replication of viruses in the body. And this will often result in the patient gaining weight. Then the patient will be less fatigued, they will have less fatigue and generally feel better, because these drugs will now help the patient have less worries about their body. It will affect how they go towards certain things, how they handle certain things, because they are more energetic and at least they're gaining weight. And another point that we can say is they will lessen the sickness burden on the patient, and that will help improve the quality of life. They often can return to work and to their other usual activities. So as the person's immune system improves and virus suppression is achieved, they can now return to their usual activities and start work, therefore improving the quality of life. Then our last goal, our fifth goal, is reduction of transmission to others. Reduction of transmission to others. So higher HIV viral load are associated with increased risk of HIV transmission from mother to child and also between sexual partners. Higher HIV viral load are associated with increased risk of HIV transmission from mother to child and also between sexual partners. So as the viral load is high in a person, it will the high viral load or the viral unsuppression will result in transmission of this virus to another person if they are sexually involved, or if they are having unprotected sex, or if the mother is pregnant, the woman is pregnant, she can easily transmit these viruses to the fetus or the child because of high viral load. So as combined ART, it helps the patient achieve virus suppression, therefore reducing the viral load to undetectable levels and preventing transmission of the virus from one person to another. So combined ART has shown to decrease the risk of mother-to-child transmission of HIV. It is also an effective method to reduce the risk of sexual transmission of HIV by lowering the viral load. So this is what we can talk about when we talk of the 5 goals of ART. So we have looked at the 5 goals of combined ART. We've looked at their benefits. We even tried to explain. So now we are going to move to initiation or initiating combined antiretroviral therapy or combined ART. So this combined ART consists of at least 3 or more drugs from at least 2 groups. So that's how we make the combined antiretroviral treatment or therapy. So it is sometimes we get 2 nucleoside reverse transcriptase inhibitors plus one nucleoside reverse transcriptase inhibitor, or we can get 2 nucleoside reverse transcriptase inhibitors and 1 protease inhibitors. So it just depends with how this drug is formed. So we are going to see how these drugs are formed up when we're talking about the classes, and we'll get to understand more. So stay tuned and watch that video. So drug selection to initiate combined antiretroviral therapy. So what are the factors that are considered when considering to put this patient on combined ART? So the first thing is the patient should be found positive. And then from there now we can now consider the following. So the first thing is the effectiveness of the regime. So we have to understand how effective this regime or this drug, this combination is to specific groups of patients. And then we're also going to check the side effects and the toxicity of the drugs. So we have to understand how toxic these drugs can be and the severe side effects that we can mitigate and warn the patient of these drugs and side effects that come from the drugs. So we can also look at convenience. How convenient is this drug to this patient? How is the frequency of the dosage? How is the burden or the pill burden, which is how many tablets will they be taking? Will they manage? All these things have to be considered. Then the fourth point, potential for interaction with other drugs. So we have to understand that drugs interact with other drugs. So we have to know which drugs in our combination have to be reduced or increased in order to facilitate the interaction with other drugs. Then the other one is potential for treatment options in case the first line treatment fails. So in case of treatment failure, we have to prepare for potential treatment options, second line of treatment. So we should give a combined ART that has possible second line treatment in case of first line treatment failure. Then we also have to consider specific populations such as the presence of pregnancy. So pregnant people are a group, a special group that cannot accommodate or that cannot take certain drugs because of their pregnancy. So we have to consider pregnancy or risk of becoming pregnancy before we put the patient on ART. Then the last one is presence of optimistic infections such as tuberculosis. So the presence of optimistic infections such as tuberculosis, the drugs that are given in tuberculosis may alter or reduce the dosage in some of these ART drugs. So therefore, we have to consider the presence of these drugs. Okay, so now here we're going to look at the first-line ART drugs that are preferred in patient and have been approved in Zambia, in Zambian health facilities. So we're going to look at them in groups. So after assessment and the person is ready to start ART, the drugs are initiated. And this is done immediately or within 2 weeks. So our first group is the pregnant and breastfeeding women. Pregnant and breastfeeding women. So all of them, they can be given tenofovir plus lamivudine plus titograva as the first preferred line of treatment. And for children 0 to 2 weeks, we can give zidovudine plus lamivudine plus nevirapine as the preferred first-line ART. And then for children between 2 weeks to less than 5 years old, and that way to less than 20 kg, we can give abacavir plus abacavir plus lamivudine plus propinavir ritonavir. And then for children that are 20 to 24.9 kg, we're going to give abacavir plus lamivudine plus titograva. Abacavir plus lamivudine plus titograva as the preferred first-line ART. And for children that are above 25 kg, we're going to give TAF, which is tenofovir, lafenamide. So we have two tenofovirs. We have TAF and we have TDF. So in children, we're going to give tenofovir, lafenamide plus lamivudine plus titograva for children that are above 25 kg. And then we're also going to give children that are above 30 kg, we're going to give TAF plus lamivudine plus titograva, as these are some of the regimes that we can give in children between 2 weeks to less than 5 years, and according to kg, those are the ones that I've just mentioned, the preferred first-line treatment. For children with co-infection with TB and are less than 20 kg, we're going to give abacavir plus lamivudine plus rutograva of which we're going to double the dose of rutograva, because HIV co-infection with TB, we're going to give drugs such as isoniazid, which will reduce the dosage of rutograva. Or we can give abacavir plus lamivudine plus zidovudine. And then for children with co-infection with TB who are weighing 20 to 29.9 kg, we're going to give, for children with co-infection with TB weighing 20 to 29 kg, we're going to give abacavir plus lamivudine plus titograva, of which we are going to increase the dosage of titograva by 50 twice daily. So we're going to increase the dosage of titograva because in co-infection with TB, the isoniazid or rifampicin will reduce the dosage of titograva. So therefore, we'll double the dosage or increase by 50 milligrams twice daily. And then for those children who weigh above 30 kg, we're going to give TDF, which is tenofovir plus lamivudine plus titograva. Tenofovir plus lamivudine plus titograva. And we're going to increase the frequency of titograva to 50 milligrams twice daily. So here we are going to increase the frequency of titograva 50 milligrams twice a day, because the drugs that are used in TB can reduce the dosage of titograva. So for adolescents between 10 to 19 years, weighing more than 30 kg, or for all adults, we're going to give tenofovir or TAF, which is tenofovir alafenamide plus 3TC, which is lamivudine plus titograva for all adults and adolescents between 10 to 19 years weighing more than 80 kg. So these are the preferred first-line ART treatment that we find in Zambia. So in the PowerPoint, we also have the alternative regimes that we can also look at. So for more, let's refer to the updated list for ART treatment in Zambia. So if you have any questions, kindly comment and we will be able to answer. Thank you for watching the video, and subscribe to our YouTube channel so that you can access more videos for us. All right, see you next time. Thank you.